In this bulletin, 166 COVID-19 cases recorded yesterday. Ministry explores vaccine for younger generation and teams mobilized to prepare for domestic repatriation. Fiji recorded a new daily toll of COVID-19 infections with 166 cases in the 24 hours ending 8 a.m. yesterday. The ministry also recorded another COVID-19 death within this period. The patient was a 77-year-old man and was bedridden at home for several months. Permanent Secretary for Health Dr. James Fong says he was diagnosed as a COVID-19 positive patient by the CWM screening team. He adds while he had pre-existing medical conditions, based on available clinical data, the man's death is due to COVID-19. The ministry will now only report on areas of interest since the number of positive cases have grown. Dr. Fong says community transmission is broad throughout the Central Division. He adds they are expecting an increase in the number of cases in Lamy. Therefore, they're ensuring that the cases are not exported into the other non-containment zones. Some employees believe that they must be afforded the right to make an informed choice rather than being compelled to get the COVID-19 vaccine. Human Rights and Anti-Discrimination Commission Director Ashwin Raj says people have a choice, but that must be based on adequate and accurate information about the vaccine based on scientific evidence. Kritika Kumar reports.
The Director of Human Rights says the right to freedom includes the right not to be subjected to forced medical procedures without one's informed consent.
Until now, the state has not forced anybody to get vaccinated, and it is consistent with the constitutional provisions, which expressly provides that everybody has the right to be free from scientific or medical treatment.
Ashwin Raj says employers and employees need to consider the greater public interest of keeping the workplaces, homes and the country safe.
I think there is greater consideration in terms of, the interest of the community over that of the individual. So we have to look at all of those rare circumstances in which somebody, cannot be vaccinated on, religious grounds or, for health reasons and so on and so forth.
The Fiji Commerce and Employers Federation says several of its members have had a one-on-one session with its employees to inform and encourage them to get vaccinated.
Make them realize that it's all about ensuring that everybody is taken care of, and it's for the betterment. It's for everybody. The quicker we get vaccinated, the quicker the country starts opening up, the quicker everybody gets employed.
Sandeep Chauhan says Fijians need to move beyond being selfish and think about their loved ones. The Ministry of Health says while vaccination is not compulsory, as it's an individual choice, they are encouraging vaccinations to reduce hospitalizations and severe cases. Kritika Kumar, FBC News.
The Ministry of Health is exploring the vaccine options for Fiji's younger generation as we continue to battle COVID-19. Vaccination Task Force Head Dr. Rachel Davey says the decision on vaccinating those under the age of 18 depends on which COVID-19 vaccine will be approved by the World Health Organization. Dr. Davey says some parents have raised concerns with the ministry in terms of protecting their kids. She adds vaccinating children is an option which they are currently exploring.
When WHO approves this, and we're ready to explore that, but our main prime focus right now is obviously the adult population, and for which we know we have AstraZeneca.
Nearly 70 people are currently in isolation at the Police Special Response Unit in Nasinu. Acting Police Commissioner Risiate Tundravu confirmed to FBC News that they are expecting a rise in the number of positive cases at PSRU before it will decrease. Tundravu says those in isolation includes police officers and their families.
We have managed to get all these, and they are contained and they are on home isolation. Some have been taken out by the Ministry of Health to the various quarantine locations. So so far, I can say that the containment measures that are in place is working for them. We expected the rise, and then we expect again forecast that to go down.
The COVID-19 task force in the Northern Division has mobilized its provincial teams to prepare for the repatriation of members of the public from Viti Levu to Vanua Levu. The Bua province will trial the repatriation program starting today, and should all go according to plan, repatriation of individuals to Maduwata and the Konrove will follow. 12 Fijians, all of whom are returning home to Bua, will commence the repatriation program today after being stranded in Viti Levu for more than 2 months.
We will start first within Bua. Bua, we have 27 people that they supposed to come, but after listening that they will be isolated in the quarantine center for 14 days, that number had decreased.
The current COVID-19 situation has allowed many people to foster creative ways of carrying out services while adhering to the measures in place. The Oceania Hospital is taking an innovative approach through its telehealth services, reaching out to Fijians through the phone to diagnose patients. The Oceania Hospital director says some people are reluctant to leave their homes for fear of contracting COVID-19. The telehealth service is a safe way of ensuring that Fijians receive the medical care and assistance they need at this same time, minimizing movement.
So what we did, we introduced the teleservices where our general practitioners, even specialists, and our pharmacy services, you can dial in and they can come straight to your home and look after your healthcare needs in your premises.
Fine weather will prevail over most parts of the country today. There's a slight chance of scattered showers in the eastern and northern parts of the country. That's FBC Morning News. Join us at 7 p.m. for our major bulletin. For news you can trust, get the facts from FBC's TV, radio and digital news at fbcnews.com.fj. Take care and good morning.